Radio Network, 1470 AM and 95.3 FM. The Health and Wealth Radio Network. Wake up with the Steve Kane Show.
Just tell me what your problem is.
With replays overnight, every night. WNN.
Taking over-the-counter or prescription drugs unnecessarily is a drag, whereas feeling great like you used to is the way it ought to be. Learn how to feel, function, and perform to your full health potential. Tune into the Dr. Bob Martin Show, Sunday morning at 10 on Talk 1470 WNN.
People are learning in a classroom how money is made from home at Online Trading Academy. Just how much?
$100, $200, $300. They were able to get to $500 a day in a little over 8 months. $500 a day, folks, is $10,000 a month.
Get classroom instruction on how money can be made from home and how risk is limited. Learn stocks, options, futures, forex. Learn step-by-step from professional traders at Online Trading Academy.
Everyone starts off very small baby steps. You know, if you can't average $100 a day, there's no way you're going to be able to make $300 a day or $3,000 a day in the markets.
Thousands have learned how money can be made from home with limited risk at Online Trading Academy. Attend a free half-day class to see how it works in Broward and Palm Beach. Online Trading Academy. Call now. 561-674-9800. 561-674-9800. That's 561-674-9800.
Now you can get Talk 1470 WNN on 95.3 FM too. Loud and clear. Health and Wealth Radio, WNN.
Are you having trouble sleeping or staying asleep? Feel like you've tried everything and nothing works? Studies show if we are out of balance or too acidic, it can directly affect our sleep. Now, a new doctor-formulated solution is available directly to you. Alkaline Boosters is a fast and natural way to get a restful night's sleep. Take advantage of this promotional offer to buy your Alkaline Boosters today and start sleeping better tomorrow. Call 1-800-994-5361. That's 1-800-994-5361.
SkyMed Pharmacy is a full-service pharmacy. Our services include home infusion therapy, nursing services, and a mail order pharmacy delivering specialty drugs directly to your home. Our team of clinical pharmacists, certified technicians, and nurses provide comprehensive patient care, generating treatment of chronic diseases both attainable and affordable. SkyMed has a foundation department and a copay assistant program. Our staff is available daily to answer any questions you may have. Contact SkyMed Pharmacy and Infusion Services at 866-778-8255, 866-778-8255, or visit us at skymed.com. That's SKYEMED.com.
Are you looking for short-term inpatient rehabilitation or long-term care placement for yourself or a loved one after illness or injury? Whitehall Boca Raton Skilled Nursing and Rehab Facility has served South Florida for over 35 years. With care and oversight from our experienced physicians, Whitehall Boca Raton offers specialized comprehensive nursing and rehab programs in neurological, orthopedic, cardiac, pulmonary, and post-operative surgical care and outpatient therapy provided by our highly experienced nurses and therapists. While recovering, you will receive 24-hour licensed nursing care along with dietary and nutrition services. We accept Medicare and other major insurances. Come see the Whitehall Boca Raton difference. Call 561-392-3000 for more information or to schedule a tour with our admissions team, and we will answer any one of your questions. You can also visit our website at whitehallboca.com. For more information, call 561-392-3000. That's 561-392-3000. Whitehall Boca Raton is committed to provide you with the best medical care.
Do you suffer from back, joint, or muscle soreness? Recovery with HydroFX is the doctor-recommended all-natural solution you've been looking for. Now, available in the U.S., Recovery with HydroFX is a specialized product for headaches, back, joint, and muscle soreness. Get back to feeling great today and order your 30-day supply of Recovery with HydroFX. Call 1-800-994-5361 and take advantage of this limited radio offer. That's 1-800-994-5361.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Do you have a hot new business or an established business that offers great and unique services or products that you want to get the word out? Are you looking to grow your business and you want everyone to hear the buzz about it? Do you have an amazing project or an idea that impacts our community that you want to share and get others involved in? Then you've come to the right place. You're listening to Community Connections with Norma G. I'm your host, occupational therapist Norma Guerrero, and I want to share our passions while connecting with our community. So now let's get ready to hear about what's hot, what's new, and what's happening on Community Connections with Norma G. Give us a call at 888-565-1470 and join our conversation.
Just couldn't.
It's all replay. Hello, welcome to Community Connections. I'm your host, Norma Guerrero, and today is Monday, August 7th, and we have a very full show today with a variety of different subjects, from medicine to caregiving to food. And so I just want to welcome everyone who's listening on the show, that you can listen to us live if you are watching us on Facebook at 95.3 FM on your radio dial if you're getting ready to jump in your car because it's 5 p.m. and the work day is over, Monday's over. Or you can listen to us at 1470 AM at WNN, which is the Health and Wealth Network. You can listen to us on your iHeart app on your phone at 1470 WNN AM, 1470 AM, as well as we are streaming live as we speak on my Facebook page at Community Connections with Norma G. And you can also find us on YouTube at AMP2 TV, AMP2, the number 2 TV Productions, as well as on Periscope at AMP2 TV Productions. So I just want to give you guys all that information as well. And so I want to go ahead and let you know what we're going to be talking about today. We have a variety of things. We're going to have Dr. Jaime Boquero, and he is a pediatric neurologist, and he's going to be sharing with us about the specialty of neurology, as well as highlighting specifically his areas of specialty within the neurology of epilepsy and of autism. And so we're going to have a lot of questions about what are those conditions, how are they treating them, and when do you seek a neurologist? What types of signs and symptoms do you talk about with your doctor, and you say, you know what, maybe you need a neurological consultation. Then we're going to have on Mrs. Fiona Della Ventura, and she is the business development manager of Caring Transitions of Palm Beach, and that is a company that services the seniors and their families that help you transition your loved one when they need to move maybe from their home into your home, into an assisted living, an independent living. And it's more than just packing up the boxes. And so she's going to talk about the specialty service that they offer to take the stress out of that process. So we're looking forward to bringing Fiona on later on after we speak with the doctor. But many of you may be wondering, why do I have a plate of food sitting here in front of me? Well, we received a phone call from one of our former guests. We had Miss Cindy Broom on earlier, and she does some social media marketing. She has a company. And so she has this gentleman, Mr. Chris, I'm going to read off this page here, Mr. Chris Salamone, I should have asked him. He basically owns Brooklyn's Original Pizzeria, and they are located in Delray Beach. And so they brought an entire spread for the entire studio tonight of about 3 or 4 different pizzas, 3 or 4, this is Grandma Sicilian pizza. They brought in meatballs, penne alla vodka. So basically the entire studio tonight is being fed by this wonderful gesture that Brooklyn's Original Pizza brought us all this food. And so I'm going to read off some information about them so that you know about them. And I may take a little nibble as we move on through the show. And so Brooklyn's Original Pizza is located at 3025 South Federal Highway in Delray Beach, located half-mile south of Linton Boulevard in the Walmart Grocery Shopping Plaza. Their phone number is 561-501-2000. Their website is www.brooklynsoriginal.com. Their Facebook page is Brooklyn's Original Delray. And their tagline is Pizza Made Perfect. And Brooklyn's Original Pizza, where making the best pizza in South Florida is our only passion. And Brooklyn's Original Pizza is family owned and operated. They take great pride in food we make and only use the best and freshest ingredients. And so if you live in Delray, and if you are on the near the Linton area, or if you're ever hanging out around that area, stop by Brooklyn's Original Pizzeria. And I've been taking a few bites before we started the show, and I had been enjoying the food. They say you're not supposed to eat on TV, but it is dinner time a little bit. So it's very, very good. And I want to thank Chris for bringing in the food. And then once again, their phone number is 561-501-2000. And so I wanted to also thank our sponsors of the show, Whitehall Boca Raton, and they are a skilled nursing and rehab facility located on Boca on Palmetto and Powerline. Their address is 7300 South Del Prado Circle South, and their number is 561-392-3000, and they are a rehab facility that offers rehabilitation for people after a fractured hip, a stroke, a medical injury, and they offer speech therapy, occupational therapy, physical therapy, and skilled nursing services to help you recover and get back home. And on that note, I want to introduce my first guest of the evening. And my first guest of the evening is Mr. Dr. Jaime Boquero, and he is a pediatric neurologist. He graduated from the Universidad Nacional Pedro Enriquez Ureña, Escuela de Médico, Santo Domingo, Dominican Republic, in the year 1986. And so he is a local pediatric neurologist. And as I mentioned in the previous weeks, West Boca Medical Center has been providing various types of doctors through the relationship that they have with Whitehall Boca Raton to provide various amounts of education for our guests and for our listeners. And so today we're going to be highlighting the specialty of neurology and his particular specialty of epilepsy and autism. And so, Dr. Boquero, it's very, very nice to meet you.
It's very nice to be here.
Oh, I'm so glad that you're here. I'm going to go ahead and move this food away, and I'm going to put it over here. And we'll get back to that maybe when we go to commercial. I'll take another little bite. And so, Dr. Boquero, thank you so much for coming in today. It's very fascinating for me to have this opportunity as an occupational therapist that myself has a specialty in neurology related to spinal cord injury, CVAs, cerebral vascular accidents, and strokes. And so I primarily treat the senior population or the older adult population, whereas you specialize in pediatrics.
Correct.
And so can you tell me a little bit about just what neurology is, what a neurologist does in general, and then how you kind of branch towards pediatrics?
All right. So neurology primarily deals with obviously the central nervous system and its diseases. No? And a pediatric neurologist typically will see children between a newborn baby, which can be as premature as 24 weeks, all the way to 18, 21 years of age, for a variety of conditions.
Okay, very good. And so when you say the central nervous system, what does that mean?
So the brain, it's the way we talk about the central nervous system is like divided by the brain stem. We have the spinal cord, peripheral nerves, and that's what encompasses the nervous system.
Okay, so
the central nervous system is more specifically talk about the brain itself.
The brain itself, the brain. Okay, very good. And so when you are dealing with children at a young age, what types of conditions do you find yourself seeing?
Well, that kind of changes with age. So although we see many things across all ages, there's certain things that are more prevalent at certain ages. So for example, in the newborn period, we frequently see strokes, which you mentioned.
Really?
Which although rare, they're not necessarily the same way that you conceptualize an adult stroke, but there are nevertheless, cerebrovascular accidents. Many times they actually have occurred in utero, and we discover them after birth. Sometimes they call me for seizures in the neonatal ICU, and sometimes metabolic conditions. Occasionally there will be a child with Down syndrome or other recognizable syndromes that you can recognize in the newborn.
So when you
as the age, as the population ages, then other things that we tend to see more often, and then we see children when difficulties in school, when they're now in the school age group, and learning issues and difficulty focusing, and children with tics and Tourette syndrome.
Right.
Then epilepsy also is a big chunk of what we see in what I call like a middle schooler.
In a middle schooler. And so when I look at these stats, epilepsy affects an estimated 10.5 million children worldwide, and the types and severity of this disorder can vary significantly. And so when we think of the word epilepsy, what does it mean? And is epilepsy different than seizure disorder?
Right. So seizure is actually just the occurrence of a abnormal electrical discharge in the brain, which then leads to symptoms that can be most of the time recognized as a person staring or doing some other peculiar behaviors and having a frank, convulsion that's shaking. So that is a seizure. Epilepsy is defined as a enduring tendency to have recurrent seizures. So that's what epilepsy is. It's like the tendency to have, if you have recurrent seizures, then we call you epileptic. It's like a person has one asthma attack, and you're not going to call it asthmatic, but
Right.
if it's a recurrence attack, then you call that person an
So
asthmatic.
epilepsy is when you have a recurrent or a chronic type of condition of a seizure disorder. Okay, well, that's very good clarification. So what is the earliest onset that you see seizures in children, you know?
So we can see them in the newborn, you know, and many times they can be either the result of a difficult delivery, sometimes the complications of metabolic disorders of inborn, errors of metabolism. Sometimes as simple things as low glucose, low calcium, a low potassium in your blood, and things like that can trigger seizures, and those are very easily corrected. On the other hand, you have conditions like maple syrup urine disease or other metabolic disorders, which with careful testing one can diagnose and treat accordingly.
That must be very scary for a parent if they are, in that first 6 months or to a year, their child experiencing a seizure.
Yes, that is true. I mean, like that is just today I saw a mother in the hospital, and the child had actually a focal seizure. Just one part of the face was twitching, but for her, she thought the child was having a stroke. I mean, parents, they don't. I always say that they don't teach these things in high school or in college, and so they don't prepare you for any of these. And the first time you see it, unless you have a family member and you've seen it before, it is a very frightening thing.
Right. So you said the word focal seizure, and I know that there's a couple different types of seizures.
Correct.
What are the different types?
So we have several types. The most common seizure types that we see are what we call absent seizures or petit mal seizures, which are children who will stare for 10, 15 seconds, 20 seconds, sometimes motionless, sometimes with a very rapid eye blinking, but they're not responding to the environment, and then within 2 seconds they're back and they continue to do exactly what they were doing
And you
before.
call that a
petit mal seizure or
petit mal
absence seizure.
A what?
Or absence, that's like a French word, I guess.
Absence.
Absence.
Okay.
Because they're absent for that. I mean, it's cute that I have a patient of mine, I keep quoting him forever because I asked him, so what happened? And then he said, well, my mind went on vacation and I came back.
And he's aware? Are they consciously aware when they're having these seizures?
Well,
Do the kids?
They're unconscious while it's happening, but after they've been having it for a while, they realize that, well, I was here and what just happened in the last 20 seconds.
So that's one type of seizure. What is the other type?
So we have, which is something that I wanted to clarify. Most parents seem to think that seizures, there's only two types, like the grand mal seizure, which is when somebody's convulsing, which is the big generalized tonic-clonic seizure that you see in the movies and whatnot.
And can you see that in children?
Oh, yes, absolutely. But there's an intermediate, something that we call partial seizures. So the seizures occurring on one hemisphere of the brain only, has not crossed to the other side. So it's longer than your petit mal seizure. It's not just 10, 20 seconds. It may be 2, 3, 4 minutes. A child staring, it may be doing some automatic behavior, holding this for no purpose, their eyes are drifting. And that is called a partial complex seizure. And I mention this because the perception of people is that there's only two types of seizures, grand mal seizures and petit mal seizures and nothing in between. And partial complex seizures or partial seizures where they're simple or complex needs to be recognized as such.
You know, as you begin to speak and share about these different things, it's very complex, the subject.
Yes.
It's not really something that we can kind of really fully grasp a complete understanding of, in 15, 20, 30-minute, discussion that you and I are having. And I think that what I wanted to share about you that you shared with me, that in your education in neurology, that not necessarily all neurologists, do you have some extra special training in epilepsy specifically?
That's
because that's what I wanted to share with them, is that you have a keen interest in epilepsy specifically.
Yeah, that is correct. I mean, a lot of us, you finish your neurology 3-year training and people will go to practice, and a lot of us do have an interest in epilepsy, and so that really requires extra training, and it's a 1 to 2 year fellowship after you have finished your basic neurology training, and you spent all that time interpreting EEGs and learning how to interpret those complex brain waves and patterns and seeing epileptic patients in clinics and videos, and it's really, for me, it's a fascinating field.
Right, because that's of interest to you. And so it's just great to know that, people that are struggling with this condition, that they can reach out to you so that you can help, properly diagnose or give a prognosis and those types of things to a very complex, scary condition. What do you think causes seizures, doctor?
So there's no one cause of seizures that we can say. We tend to classify seizures into what we call idiopathic, meaning that we don't know really the cause, and symptomatic, that they're secondary to something. So that something can be anywhere, like from some sort of stroke or sometimes difficulty, like I said, at birth, and where the child may have some lack of oxygen at birth and suffer some injury. Certainly developmental anomalies, the brain during development can form in an anomalous way, and that can cause an area of epileptic focus. Metabolic disorders, infections is very important.
Yes.
Maternal drug use,
Well, that's what I was just going to ask you, maternal drug use. What about paternal drug use in the sperm?
That has not been an issue. It's really a withdrawal, usually from barbiturates, that the mother has been using, and if the child is confused as being depressed at birth, because sometimes, the mother has used the drug very close to delivery.
So it's not so much if they were using drugs prior to the conception of the child, but the actual during. the what do you want to call it, the pregnancy
itself.
So it's more the during.
Yes.
So not necessarily your bad habits prior.
Correct.
Well, that's kind of good to know.
Yes,
Good to know.
True.
So I have a question that came from some people that I know, that the two of their children had issues with seizures between 1 year and 3 years old, and they were on phenobarbital. Phenobarbital is a medication for seizure prevention.
Yes, correct.
Seizure prevention. So now these kids are now moved on, and they're 20 plus years old. They're fine. They're doing well. They both actually recently given birth, both of these children, and so now one of them's 11 months, another one's 13 months. Can that be an issue for the offspring of those children?
It can be. One has to be careful not to over-exaggerate or create a lot of anxiety unnecessarily. Sure, there will be slightly higher incidence, particularly if you can identify which kind of epilepsy, because some of them are more inheritable than others.
Okay.
So, like, for example, when I hear that there's a family history of epilepsy, I actually, more often than not, I'm happy, because most of the inheritable epilepsies are very outgrowable. You can outgrow them more easily. Whereas the acquired from stroke or whatnot, you're probably going to have for life.
Okay. So it's different than when you have like a traumatic or a condition that happens after the birth process.
It just makes it less likely to outgrow it.
Okay, makes you less likely. Okay, very good. So now you're functioning. You practice it through West Boca Medical Center as well as through Delray Medical Center, I believe, in St. Mary's.
Correct. I'm a part of a multi-specialty pediatric group. It's called Kids Medical Services,
which is what I was going to get to.
But I've been in the community since I want to say 1994. I was on staff at West Boca.
Wow.
And I've been here since.
Yes, and I know they have a pediatric unit there. And so West Boca Medical Center is on 441 between Palmetto and Glades here in West Boca Raton. And so Kids Medical, if someone wanted to look that up, what is the website and phone number to Kids Medical if someone wanted to reach out to you, Dr. Bochetto?
The easiest way to reach out to me would be there's www.kidsmedical.com. Or our telephone number in our office, which is 561-470-6177. My assistant's name is Sandra, and we try to do our best to accommodate people.
Right. Well, I'm going to take a little commercial break, and I'm going to keep you on set because I want to have you come and talk a little bit about autism, which is another very, very prevalent, a lot of misinformation about autism. And so I thought we could maybe define that a little bit, talk about what you can share with people struggling with that. So we'll be right back, and I'm going to eat a little bit more of my Brooklyn's original pizzeria, and we'll be right back with Community Connections.
Do you suffer from back, joint, or muscle soreness? Recovery with HydroFX is the doctor-recommended all-natural solution you've been looking for. Now, available in the U.S., Recovery with HydroFX is a specialized product for headaches, back, joint, and muscle soreness. Get back to feeling great today and order your 30-day supply of recovery with HydroFX. Call 1-800-994-5361 and take advantage of this limited radio offer. That's 1-800-994-5361.
Are you looking for short-term inpatient rehabilitation or long-term care placement for yourself or a loved one after illness or injury? Whitehall Boca Raton Skilled Nursing and Rehab Facility has served South Florida for over 35 years. With care and oversight from our experienced physicians, Whitehall Boca Raton offers specialized comprehensive nursing and rehab programs in neurological, orthopedic, cardiac, pulmonary, and post-operative surgical care and outpatient therapy provided by our highly experienced nurses and therapists. While recovering, you will receive 24-hour licensed nursing care along with dietary and nutrition services. We accept Medicare and other major insurances. Come see the Whitehall Boca Raton difference. Call 561-392-3000 for more information or to schedule a tour with our admissions team, and we will answer any one of your questions. You can also visit our website at whitehallboca.com. For more information, call 561-392-3000. That's 561-392-3000. Whitehall Boca Raton is committed to provide you with the best medical care.
SkyMed Pharmacy is a full-service pharmacy. Our services include home infusion therapy, nursing services, and a mail-order pharmacy delivering specialty drugs directly to your home. Our team of clinical pharmacists, certified technicians, and nurses provide comprehensive patient care, generating treatment of chronic diseases both attainable and affordable. SkyMed has a foundation department and a copay assistant program. Our staff is available daily to answer any questions you may have. Contact SkyMed Pharmacy and Infusion Services at 866-778-8255, 866-778-8255, or visit us at skymed.com. That's SKYEMED.com.
Are you having trouble sleeping or staying asleep? Feel like you've tried everything and nothing works? Studies show if we are out of balance or too acidic, it can directly affect our sleep. Now, a new doctor-formulated solution is available directly to you. Alkaline Boosters is a fast and natural way to get a restful night's sleep. Take advantage of this promotional offer to buy your Alkaline Boosters today and start sleeping better tomorrow. Call 1-800-994-5361. That's 1-800-994-5361.
Thank you for listening to Community Connections with Norma G. We're the place where we talk about your business, a product, an idea, or a project to get the word out to our community. I'm your host, occupational therapist Norma Guerrero. Today we are sharing our passions while connecting with our community. Give us a call at 888-565-1470 and join our conversation. Don't forget to tune in every Monday night at 5 to 6 p.m. to join me, Norma G, and our guests to find out about what's hot, what's new, and what's happening in our community. Can't wait to see you there. Now let's rejoin the show. We're going to go live.
All right.
Welcome back to Community Connections. I'm your host, Norma Guerrero, and I have just been diving into this meatball here, and I have to tell you that this Brooklyn's Original Pizzeria, and I'm not just saying that, it is really good. So I'm going to take another bite, Dr. Pacaro.
Enjoy.
They say that, well, when we're done, I think you're going to go out there and eat a little bit.
I'm going to have a slice.
Yeah, because I think we got Kathy back there from West Boca. She's over there having a slice herself, and so... once again, we can find Brooklyn's Original Pizzeria at 3025 South Federal Highway, Delray Beach, 33483. We want to thank them so much for feeding us all tonight here in the studio. They brought food for like 25 people. Their website is www.brooklynsoriginal.com, and their Facebook page is Brooklyn's Original Delray. And their phone number, I guess if you want to order takeout, is 561-501-2000. And their tagline is Pizza Made Perfect, and Brooklyn's Original Pizza, we're making the best pizza in South Florida, is our only passion. They're family owned and operated. They take great pride in their food, and they make and only use the best and freshest ingredients. It tastes very good, and so I'm very happy that they brought that in for us tonight, because sometimes when we're working at these hours of the day, we don't get to eating until 8:39 when we get home from the studio. So it's nice to have a little something with us. And they brought us some penne alla vodka, the bunch of cheese pizzas, pepperoni pizzas, meatballs, as well as Grandma Sicilian pizza. So check them out in your leisure time. And so to get back to Dr. Paquetto, he's our pediatric neurologist that's located here in West Boca, South Florida. And I know that you're affiliated with a lot of organizations. You have this company, Kids Medical, that you work with a variety of other health professionals, helping treat the pediatric populations who have neurological conditions. And what gravitated you, Dr. Paquetto, towards pediatrics? Just in your, when you were first going through your residencies and all that.
So when you're
or
in
did you
medical
know
school,
off the bat?
No, I did not. I think most of us, like in our third year of medical school, because I get students now from FAU that come and shadow in my office. And, usually the third year of medical school is when you start to do the rotations and you start doing the clinical rotations. So you go to the hospital and start seeing the actual real patients, And so you start getting the orthopedic rotation, the gynecology rotation, the surgery rotation, and you start figuring out what is it that you gravitate or you like. And certainly for me, the third year was one just to quickly realize that I didn't like orthopedics, that I didn't like surgery, that I didn't like GYN. So I really, by order of elimination, those I didn't like. And then very quickly in my fourth year, I realized that I wanted to be a pediatrician.
Now, as a pediatrician, but then to do a step further to be a neurological.
Well, that's, I guess, a combination of things, I would say. So I guess my father was an adult psychiatrist, and trained in McGill, the whole thing. So I grew surrounded by many books that had to do with the brain, whether it was the mind or.
So that's what happens.
And that was part of it. I think I also, as a youngster, had an injury to a peripheral nerve, and I had a foot drop, and started reading about nerve regeneration and things like that, and all that sparked some of the interest.
Okay, well, very good. It's good to know. I'm always curious how people kind of go into their specialty, and sometimes it comes from the environment that they grew up in, or some sort of incident that happens in their life. And so we mentioned that we want to now delve into the subject of autism as well as ADHD, which is attention deficit hyperactivity disorder. And this is the facts that I have here, that in an estimated they affect more than 3 million individuals in the U.S., that more children are being diagnosed with autism more than HIV, diabetes, and cancer. And it's a very, very expensive for the nation, $238 billion per year, expected in significant increases in the next decade. And so do you agree with these stats?
I agree with those numbers. I mean, it's tremendous.
And so the conversation is, why is it that autism is on the rise? Is it because just the doctors have a better understanding of what it is to diagnose it, and it was just maybe missed and misdiagnosed before? Or do you think there's something happening in our environment?
I think there's probably a combination of sometimes we want to explain everything with a unitary theory. I think it's a combination of things. I think that, yes, we are smarter at recognizing it earlier and more often.
As many conditions.
Yeah, exactly.
As many conditions.
As many other things. But I think that also there is an increase, and the science is still not clear. There are some risk factors that are being put out there, some of which are fairly well proven. Some of them are still in the table to be further studied. The most common ones that you hear is like, advanced maternal and paternal age, which used to be, and for a lot of parents, they knew there was a risk for Down syndrome. Well, advanced paternal age and maternal age can be also a risk factor. Prematurity can be a risk factor. And there are other risk factors that we don't understand.
I mean, would you say that in the last 30 years that there are people in advanced maternal age having children versus the previous?
I don't know a statistic, a demographic statistic like that.
But socially, I think
I think it's unfair that there are more people having their children in an older age, and that may be contributing to the rise.
Perhaps.
And perhaps there are other environmental things that we haven't figured out. Now, genetics is big. Yeah.
Right. And so briefly define autism for us, Doctor.
So basically, autism is a neurodevelopmental condition that is really characterized by a social and communication difficulty. That's the main impairment.
And what are the early signs that parents, how early on in the children are they noticing these things?
So typically, the patients will come to the office, so the American Academy of Pediatrics now recommends that the pediatricians do screening for autism at 18 months of age and then at 24 months of age, which they have visits, regular baby care visits. So I usually will get patients referred after that age, But when you ask the parents, when did you really were worried about anything at all with your child, they will say as back as 6 months, 9 months, 12 months. Some of those red flags were there.
Right. So when you get this referral, so they go to their pediatrician 18 months and they maybe show a sign and then they get referred out to you as a neurologist. You do your testing with them. And then what treatment recommendations do you offer?
Right. So, I mean, I think that most of the children, like by the time they get to me, they are probably already getting speech therapy because one of the main issues is they have a communication disorder. And so, but if they're not, obviously, that is a very important recommendation to make. One critical part of the treatment, which I think is, people don't know about it enough, is called ABA therapy. And ABA therapy stands for Applied Behavioral Analysis based therapy, which is developed like the Kennedy Krieger Institute at Johns Hopkins by Dr. Lovas years ago. It's become the most important therapy that they need for language.
Is that a drug or is that
it's a therapy. It's actually, people get certified and they get boarded in ABA therapy. It's a very important part of, I think the most important part, not just for the targeting their problem behaviors and the repetitious behaviors, but actually for language acquisition as well.
And this ABA therapy is administered by what therapists, physical therapists, occupational speech therapists?
There are specific therapists that are trained in ABA therapy only. They're not part of, they're not speech therapists. Their only field is that of ABA therapy.
Very, very interesting. I wasn't aware of that. I'll have to
very,
look.
very important.
So that's one thing that you can recommend is to find a ABA therapist?
Absolutely, and I've seen.
Are there some here locally? Do we?
There are many. There are actually institutions. There's many resources that I could name, but there's like plenty of places that, and it's a therapy that's actually done at the home setting, because the naturalistic environment leads itself for better response from the child, and more importantly the parent training, because the therapist is working with the child, but it's also teaching the parents
how to administer the care,
so that when they're not there, that therapy doesn't stop.
Yes. Well, as we've mentioned before, I'm an occupational therapist, and I've done rehabilitation for over 20 plus years, but I never have overtly got myself involved in pediatric care, primarily adult and senior care. And sometimes we see these seniors and adults with these psychological conditions later on, but it's different than when they're in early development. And so, I reached out to some friends that I know, some colleagues that I know, and specifically a very dear friend of mine, Charmaine in California. She is an occupational therapist, and since her and I graduated together, but for 24 years she has worked in pediatrics as an occupational therapist, and if I'm not mistaken, Gallagher Therapy. I know they'll be listening later. And so I called her and I said, if you were to talk with a neurologist, what would be your questions? And so she basically, if you don't mind, may I ask these questions?
Well, the first thing I want to say, not because she's an occupational therapist, because I was going to say it anyway, is that aside from speech and ABA therapy, many of these children have many sensory issues. Whether it's over or hyper or hyposensitivity. So occupational therapy is an integral part of the therapy as well.
Yes, and we know that because of the stimulation that's required to help the developmental stage. Sometimes when the kids are a little bit challenged, not only with their speech but also physiologically, with their coordination, with their proximal muscle strength, and those types of things.
And even auditorily, they have a very high sensitivity to loud sounds and aversion to tactile things.
Right. You mentioned that you read tests and studies, and so one of her questions is, when you look at the brain in a child with autism versus not, are there physiological change and differences?
So there have been studies, anatomically, I hope that's what she's meaning.
Mm-hmm. Anatomically, yes.
Anatomically, there's been plenty of studies, and so the first one that I can quote, I think was done at Emory University, and that was that the brain volume itself, if you look at the average brain volume in 3D reconstruction of the brain tissue, it tends to be actually larger in a child with autism when compared to the age-matched child who doesn't have autism. Then there are obviously some other anatomical differences that have been seen. The cerebellum, which sits in the back of our brain, which is our, we were taught that is an organ for coordination. Well, it has to do with memory, with behavior as well. And there are some cerebellar, fine, very subtle anomalies that can be seen, but it's only about 5% of the children that have these subtle changes in their brain anatomy, and it generally does not translate into something that we do different therapeutically.
Right.
So whereas like maybe 20 years ago we were ordering MRIs in every child we saw with autism, now we try to select
who
we do.
Right, because I know when they look at the patients like with Parkinson's, they see the different levels of the dopamine in the, I believe it's dopamine in the brain and stuff like that.
I mean, functional imaging is a very important thing, and the paradigms for functional imaging in autism are ongoing.
Right. And I have one more question for you. And so in ADHD, when the children, as they get older, do those symptoms of attention deficit or hyperactivity disorder, is it that they kind of grow out of some of those symptoms, or do their coping skills get better? I guess a separate question is also neuroplasticity in the brain. Is it at 7 years old that neuroplasticity tends to kind of plateau, whereas sensory integration isn't as effective at that time?
That's actually one of the greatest myths that that we ourselves had. In fact, in training myself earlier on in adult neurology, it used to be thought that plasticity, which is the ability of places of the brain to compensate for all the areas of the brain that may be damaged or not functioning well, that there was a sort of like a window that would close on you.
Right.
And the fact is that neuroplasticity continues until you're an adult, and so perhaps though, the amount of recovery obviously is going to be better the earlier.
Early intervention is the key.
Yes.
So, Dr. Bocchetto, it's a fascinating subject, neurology, let alone pediatric neurology. And so, once again, if our guests wanted to, or if any of our listeners or anyone listening to this in the future wants to reach out to you, how do we find you? Where are you located? And your phone number, sir. All
right. So, my office is in Boca Raton, in West Boca Raton. And I'm at the campus of West Boca Medical Center. And telephone number is 561-470-6177. And there's a website also, which is kidsmedical.com. And you can find us there as well.
And Kids Medical is with a Z.
Yes,
KIDZ, not with an S. Yep, I wanted to point that out. Dr. Bocchetto, thank you so much for taking the time. And really, I think it's wonderful working with the children and helping those parents out with working those things. So give Dr. Bocchetto a call if you have any questions for him. We'll be right back with Fiona Della Ventura of Caring Transitions of Palm Beach. Welcome back.
Thank you.
Thank you.
Are you having trouble sleeping or staying asleep? Feel like you've tried everything and nothing works? Studies show if we are out of balance or too acidic, it can directly affect our sleep. Now, a new doctor-formulated solution is available directly to you. Alkaline Boosters is a fast and natural way to get a restful night's sleep. Take advantage of this promotional offer to buy your Alkaline Boosters today and start sleeping better tomorrow. Call 1-800-994-5361. That's 1-800-994-5361.
SkyMed Pharmacy is a full-service pharmacy. Our services include home infusion therapy, nursing services, and a mail-order pharmacy delivering specialty drugs directly to your home. Our team of clinical pharmacists, certified technicians, and nurses provide comprehensive patient care, generating treatment of chronic diseases both attainable and affordable. SkyMed has a foundation department and a copay assistant program. Our staff is available daily to answer any questions you may have. Contact SkyMed Pharmacy and Infusion Services at 866-778-8255, 866-778-8255, or visit us at skymed.com. That's SKYEMED.com.
Are you looking for short-term inpatient rehabilitation or long-term care placement for yourself or a loved one after illness or injury? Whitehall Boca Raton Skilled Nursing and Rehab Facility has served South Florida for over 35 years. With care and oversight from our experienced physicians, Whitehall Boca Raton offers specialized comprehensive nursing and rehab programs in neurological, orthopedic, cardiac, pulmonary, and post-operative surgical care and outpatient therapy provided by our highly experienced nurses and therapists. While recovering, you will receive 24-hour licensed nursing care along with dietary and nutrition services. We accept Medicare and other major insurances. Come see the Whitehall Boca Raton difference. Call 561-392-3000 for more information or to schedule a tour with our admissions team, and we will answer any one of your questions. You can also visit our website at whitehallboca.com. For more information, call 561-392-3000. That's 561-392-3000. Whitehall Boca Raton is committed to provide you with the best medical care.
Do you suffer from back, joint, or muscle soreness? Recovery with HydroFX is the doctor-recommended all-natural solution you've been looking for. Now, available in the U.S., Recovery with HydroFX is a specialized product for headaches, back, joint, and muscle soreness. Get back to feeling great today and order your 30-day supply of Recovery with HydroFX. Call 1-800-994-5361 and take advantage of this limited radio offer. That's 1-800-994-5361.
Thank you for listening to Community Connections with Norma G. We're the place where we talk about your business, a product, an idea, or a project to get the word out to our community. I'm your host, occupational therapist Norma Guerrero. Today we are sharing our passions while connecting with our community. Give us a call at 888-565-1470 and join our conversation. Don't forget to tune in every Monday night at 5 to 6 p.m. to join me, Norma G., and our guests to find out about what's hot, what's new, and what's happening in our community. Can't wait to see you there. Now let's rejoin the show. Welcome back to Community Connections. I'm your host, Norma Guerrero, and you're listening to us live on my Facebook page at Community Connections, live stream Community Connections with Norma G., as well as listening on 95.3 FM, 1470 AM on your radio dial, as well as on your iHeart app at 1470 WNN. You can also find us at YouTube at AMP2 TV Productions and on Periscope at AMP2 TV Productions. If you have any questions for our guest today, you can reach us at 888-565-1470. And so our second guest, we're going to kind of shift subjects from pediatrics that we just had with Dr. Boquero over to senior caring. And so I have Miss Fiona Della Ventura. She is the business development manager of a company called Caring Transitions of Palm Beach. Is that right?
Yes, it is.
It is.
Norma.
Very nice to meet you, Fiona.
It's nice to be here.
Great,
Thank you.
great. I know we spoke a few weeks back, and then we shifted the date a little bit, so I'm so glad for you thank you for being flexible with the schedule, and also I'm very happy to have you here so you can talk about what Caring Transitions of Palm Beach does in the community. So can you share with us?
Sure, I'd love to. We are a senior moving company. We move seniors once they've made that decision to leave their single-family home to continuous care retirement communities, assisted living or memory care, or family in-state or out-of-state. We help them pack up their belongings. We also can do a floor plan. We organize the move. We can ship things if things need to go to family members. We can organize the move, pack, donate if they have items that they want to donate. We can help them declutter and get rid of things because they're probably going from a 3,000 square foot to 1,000 square feet.
Yeah, big
Can't
big
take
drop
everything
in
with
size.
you, so what can you take? That's why we can do a floor plan to show you how things will fit in your new home.
Okay.
And we do it all from soup to nuts. We have an array of services, but not everybody needs all of our services. That's why we offer a free consult to come in and see what your needs are.
That's fantastic. And so now, are you a senior placement agency as well, or just the actual part of the downsizing?
No, we do the downsizing. We come in and pack. Once you've made the decision with your family
Where you're gonna
where
go.
you're going, then call us and we help pack your belongings.
Do you work with senior placement agencies?
We do.
Because I imagine they refer to you.
We get referrals from case managers, nurse registries, home health, realtors, lawyers, anyone who knows a senior that's moving, that's our client.
Right, and sometimes that can be a place kind of like Whitehall Boca, which is a
Yes,
skilled nursing and rehab
absolutely.
facility, which, you know, you're here as a guest, you know, through them for the show. And so you met, I'm trying to think of, did you meet Sergio?
Yes, I did.
And Sergio is the marketing, director of marketing over at Whitehall Boca, which is a skilled nursing and rehab facility on Palmetto and Powerline here in West Boca. And they offer speech, occupational, physical therapy, and nursing services. And many times people fall and break their hip.
Yeah.
They end up there for rehabilitation, and they can't go back home. So they need to maybe go into an assisted living. And the daughter or son may be living in New Jersey or in Arizona, and who's going to close down this house?
Right. And that's where
Is that
we
where you
come
guys step in?
We come in, mom, like you just explained, is at a rehab and can't go home. Now she's got to go to assisted living. What do we do with the house? We need to sell the house to cover the expenses. So now we can come in and help clean out the house, pack up her belongings and things that she can take over to assisted living, And then what do we do with the rest? That we can donate, we can dispose of. A lot of times we'll donate to local charities, and then they can take certain belongings with them because they're gone to a smaller community than what they're used to living in. We pack, we ship. If things want to go to the children and they're in New York or the Midwest and the fur coat's got to go, we'll ship it, insure it, and send it on its way.
Yeah.
But the good thing is, once we pack them, we hire the movers, we follow the movers to their new location, and we resettle them. We unpack the dishes and put them in the cabinet. We make the beds. So when we're done, they're ready to spend their first night in their new home.
Turnkey. So
Yes.
would you say there's a lot of emotions involved in this process of downsizing?
Absolutely. Oh, it is. It's a very overwhelming time for them. It's very emotional because they probably lived in that house 25, 30, 50 years, and they've accumulated a lot of stuff. And now they've got to part with some of it, and a lot of it doesn't have any value anymore. It's sentimental value. And how do they part with the grandfather clock or great-grandmother's china? So we kind of help them along. We become their friend. We do a lot of hand-holding. Once we have moved
A lot
them
of story
and
listening.
resettled, we listen to a lot of stories.
Sure.
Once we resettle them and everything, we just don't leave them. We've become their friends, so we'll call and check on them and see.
That's
They
right.
can't find the towels, or they can't find their favorite glass, or they can't find the decanter to put the wine in. We will do the hand-holding with them and show them where they need to find the item that they're looking for. And a lot of times we can do it within 5 minutes to reassure them that they didn't misplace or lose something. It's just in this cabinet over here, and they didn't look in it.
And so, do you find that the children of these people are they around when you're doing this process, or are they mainly hiring you because they don't have the time to do it themselves?
It's a little bit of
Or
both.
like a neutral party, and a non-emotional neutral party, kind of like a buffer between mom, you got to do this, or dad, you got to let go of this.
It can be either one of the three scenarios you just mentioned. A lot of times it's the family out of state. That they don't have the time or can't get the time off to come and do the move. So we will talk with them over the phone and find out what the needs are. We like to meet with whoever is moving so that we get to know their story, where are they going, how much square footage they currently have, where are they going to, what's the square footage there, what their time frame is, all of that so that we can serve them the best possible way that we can.
How do you base your pricing?
Good question. It's customized. We don't have package A, B, or C.
Yeah, I figured it would be because everything's got to be.
Because we have an array of services, and not everybody needs them. Some people may need just to be packed and resettled. Others may need us to clean out completely. So we come and we offer you a free consult. We sit down with you, and you tell us where you're going, what you're doing. We take a virtual tour through the house to see what your needs are, what you're taking, what you're not taking, what you're getting rid of. Once we have all that information in our list of what you're taking and what needs to be disposed of, then we formulate a quote. And no two moves are the same, because you can say you have 3,000 square feet, so do I. Are you a hoarder?
Right.
And
So would you say this is costing, $5,000 up? Depending on, obviously, if you have a large house, is it something that could be $5,000 up?
It could be if it's a large house.
Or is there like a ballpark range that people, I know you don't want to talk numbers and all that stuff, but is there like a...
I really can't, Norma, because it's so customized.
It's so
because
customized.
it could be a small move that's $800 because you just want certain things moved to storage or to your
Right.
children's home. And you're not taking anything; you're buying all new furniture.
No,
or
you
you
never
can take the
know.
whole house.
Yeah.
So it's very customized because we need to bring a staff in to pack and move the boxes and everything. So it could be a team of 2 guys in 2 hours, or it could be a team of 6 people in 6 hours.
Okay.
It all depends on what they need, because we're not your typical movers. We just don't pack you up, move you to the location, and leave you. We unpack and we resettle.
Interesting.
And that's what sets us apart from most companies, is the resettling, the hand-holding, the becoming the friend.
And now, Caring Transitions of Palm Beach, where are you located? What service areas do you have? And what's the website and phone number?
South of Jupiter to Boca, everything in between. Basically,
So
Palm Beach County.
Palm Beach County, primarily.
Yes,
okay.
primarily. But it doesn't mean that if someone was coming from Broward to Delray, we could help.
Right. And
and
the website and phone number?
The website is www.caringtransitionspalmbeach.com.
Right here, this camera. I'm sorry. You can say it again.
It's www.caringtransitionspalmbeach.com. Our phone number, you can reach me directly at 203-623-6266.
Excellent, excellent. So when I was looking at your website, what I found very interesting is that, sometimes we're talking about someone that's resettling, but sometimes somebody passes, and you may be helping families still downsize as they need to maybe release that property or something. So you get involved in that as well?
Yes, that would be considered what we call a clean out, where we come in, the family has decided that mom has passed. So they've decided they're going to put the house up on the market for sale, and they don't want anything that's in the house. So we would come in with our team and clean out the house completely and get it ready for the realtor to do their little walkthrough and put it out on the market.
And so you have a wide variety of professionals working within your organization?
Yes, we do. We have a team. Like I said, it depends on the size of the move. It could be 2 guys. It could be 8 people. Usually we have a couple of women that'll pack and bubble wrap all of the china and breakables and all of that. And then we have the guys who will move the boxes. And then we hire movers to put everything, load up the truck. We follow the truck to the new location, and the team gets busy unpacking, putting the china in the cabinets, making the beds,
excellent,
hanging the wall hangings, putting the TV up.
You basically you're working behind the scenes.
Yes.
And as a therapist, I'm the one that's going in and working with the patient to do the rehabilitation, but if you don't know what's happening, when I move when they go from a rehab into a home health or to an assisted living, all that's happening before they discharge out. And so I think it's really fascinating. I think you probably take away so much stress and physical labor and emotional complication away from families. And so that's wonderful. Can you tell us again one more time your phone number of how to reach you and your website of how to find you?
Be reached at 203-623-6266 directly. That's my direct line. And we're at www.caringtransitionspalmbeach.com.
Wonderful. Well, Fiona, thank you so much for coming in and sharing with us about how you help the families help their loved ones transition from one facility to another. And so thank you again for tuning in to Community Connections with Norma G. And I'm going to be eating a little bit more of my Brooklyn's original pizzeria here. And when I head out there with everybody else in the studio, I want to thank Whitehall Boca for helping bring this wonderful show here together with these guests and all this education. And we will see you next week. Have a great week, everyone. You've been listening to Community Connections with Norma G. We will be back next Monday from 5 to 6 p.m. with new guests to share about what's hot, what's new, and what's happening in our community. Did you hear something you liked today on our show? Please contact me, Norma G, at 954-802-2015 or email me at ccnormag@gmail.com. I look forward to helping you expand your business, project, or idea and connect with our community.